rate, we're bound to fall further back. So let's stop and step away from our stagnation. Take a different route to a better destination.
We propose a new path to goals of sustainability, one that supports countries' healthcare durability.
Shifting paradigm towards promoting well-being and health and preventing the
coverage undeniably fair.
A new path that strengthens our systems and tools for pandemic preparedness and international health rules.
A path that harnesses the power of sciences, where innovation and data strengthen alliances. A course that bolsters our resolve and determination as the leading authority on global health information.
Over the years, we will build on these foundations to enhance the results and impact on nations and achieve the accelerated progress that's needed to reach our targets, some to be exceeded.
If we want to reach the goals of development, then we must double our efforts.
equivalent. Set low-carbon objectives at healthcare facilities. Address rising societal and economic difficulties.
We'll prioritize people, amplifying our unique voices, championing diversity and healthier life choices.
Accelerate country progress by scaling up innovation towards drugs, diagnostics, technologies, and vaccination.
Ultimately, we will hold ourselves accountable, for transparency makes all challenges surmountable. We will not surrender, for we have commitments to keep, and many billions to heal.
Billions to heal.
Before we can sleep.
Before we can sleep.
Your Excellencies, Director General, Honorable Ministers, distinguished delegates, in my capacity as the outgoing President of the 74th World Health Assembly, I am pleased to welcome you all once again. This is the first time that we are meeting in person since the 72nd World Health Assembly, and it fills me with great joy and to see everyone in good health despite the tremendous challenges that COVID-19 has had on all of us. Before we proceed to the election of the officers for the 75th Health Assembly, it is my pleasure and privilege to inform you of a presence of several distinguished high-level guests. We are honored to have them with us. And without further ado, I would like to invite the first of our guests, Federal Councillor Alan Bassett, for his remarks. Mr. Bassett, you have your floor.
La Présidente,
Madam President, Director General, ladies and gentlemen, ministers, excellency, delegates. I'm speaking on behalf of the Swiss Confederation, and in that capacity I extend to you a warm welcome. I welcome you to Geneva for this, the 75th World Health Assembly, and the theme is Health for Peace, Peace for Health. As the President has reminded us, for the first time since the outbreak of the COVID-19 pandemic, we are all here together in the same hall. It is a joy and an honor for me to be able to welcome you to Switzerland today in such conditions. This assembly is taking place in exceptional circumstances. A war is raging in Europe. There are unacceptable acts being perpetrated against civilians, acts that are unacceptable in terms of international humanitarian law. Switzerland is a custodian of the Geneva Conventions, and that being so, we are deeply committed to international humanitarian law. IHL establishes rules intended to protect access to health care during armed conflicts. This is vital. We need to guarantee protection for the wounded, the ill, health staff and their units and means of transport. In other words, health must never be a target. For that reason, I would like here to call upon all member states and all stakeholders to respect those standards and to support programs intended to prevent attacks on health services. In saying that, ladies and gentlemen, we are also obliged to look beyond the European continent. As we know, sadly, today armed conflict remains a feature of international relations. In that context, WHO, like other organizations, has a key role to play. And WHO is our organization, and we must recognize that health is a human right. It is vital for all, for every man and woman on this planet. It is a foundational pillar of global peace and security. For Switzerland, access to health care and protection in the face of health emergencies are two sides of the same coin, and for that reason we, with resolve, defend the idea of giving assistance to the most vulnerable throughout the world in all regions. We are convinced that a multi-sectoral approach based on human rights is vital to promote peace and to preserve global security. In Geneva, of course, we have been talking about peace and health for a very long time, as you know, and I'm delighted to see that the Health for Peace initiative, the result of cooperation between the Sultanate of Oman and Switzerland, has led to a decision that is before this Assembly for adoption. The initiative seeks to make health a sustainable factor for peace in the context of emerging conflicts and in post-conflict situations. We must recall the vital importance of health and peace and the vital importance of bridge building for all of our futures. Director General, ladies and gentlemen, the pandemic that our world has been grappling with for more than 2 years now is not at an end. We haven't yet defeated it. Every day, too many people are falling victim to it. Today, each and every one of us has a responsibility. We are responsible for fighting against new threats to health on this planet. And we need to do that together. And that's why this week is so important. Together, we must reiterate our commitment to ensuring a transition to decent, safe and sustainable living conditions for all. We know that time is running out, and we know that we have no excuse for doing nothing. This pandemic, Excellencies, has reminded us of a number of things. It has reminded us, firstly, that international solidarity is vital. Secondly, it has reminded us that strong multilateralism is vital. And thirdly, it has reminded us, graphically reminded us, of the crucial need that we have for an effective and universal World Health Organization. Reforms of finance and governance are vital for WHO. We all know that. If we want to make WHO stronger in its ability to respond to future pandemics, these things have to be reformed. But we need WHO. We need it to continue to be a centre for global public health. Its standard setting work also needs to be strengthened in order to allow us to detect possible future threats to global health. The pandemic has shown that we need to be able to base our work on binding international instruments. Therefore, Switzerland supports the development of a new international instrument on pandemic prevention and preparedness and on preparedness for health emergencies. And we also support the process to amend the IHRs involving better implementation of national capacity in their rollout. We need to be clear also about what we expect WHO to do. And clearly, if we want WHO to do certain things, we need to give it the means to do that. That means that we need to ensure sustainable financing for WHO. Therefore, ladies and gentlemen, I would like, bearing all of that in mind, to commend the working group on sustainable financing and its officers. They've shown great commitment and they have managed to hammer out a consensus within their mandate. This consensus demonstrates that we have collectively understood the need for a strong WHO, a strong WHO that has the resources it requires, the capacity it requires, the authority it requires in order to provide support to member states, including when it comes to pandemic preparedness and response. Director General, Ministers, Excellencies, the week ahead of us is a vital one, and the tasks and responsibilities that we have to face up to are vast. We need to work together to be better prepared at regional, national and international level in order to face up to the crises that undoubtedly lie ahead. That clearly requires strengthening our health systems and improving the quality of the healthcare we can provide. In that context, patient safety is obviously a vital public health issue. Switzerland will have the honour of organising next year the 5th Global Ministerial Summit on Patient Safety. This will be held in Montreux, not far away from here, on the 23rd and 24th of February next year. The summit will be a milestone as we move forward in our international efforts to strengthen patient security and to find solutions that will allow us to guarantee patient safety and security. I therefore invite each and every one of you to attend that 5th Global Ministerial Summit so that we can discuss these important issues together. In conclusion, ladies and gentlemen, it is an honour and also a particular pleasure for me after the 2 years when we haven't been able to meet in person, it is now a particular pleasure for me to invite you all this evening to attend the reception to be offered by Switzerland, as is our customary practice. It will be held at 6 p.m. in the new part of the WHO building. I very much hope to have the pleasure of welcoming you personally at that reception alongside the Director General. I wish you all an excellent World Health Assembly and every success in your work. Thank you.
Thank you, Mr. Bassett. I shall now invite the President of Kenya, His Excellency President Uhuru Kenyatta.
The President of the 74th World Health Assembly, Heads of State and Government, Dr. Tedros Ghebreyesus, WHO Director General, Honorable Ministers, ladies and gentlemen, we are pleased to be here at this historic regular session of the World Health Assembly, the first such assembly in person since early 2020, when the COVID-19 pandemic was declared a public health emergency of international concern. I wish to take this very early opportunity to applaud the efforts of all the nations represented here today for the bold and decisive actions taken collectively and with your respective national contexts to address the greatest health emergency that has been witnessed in our lifetime. In this year, commemorating the healthcare workforce, I would be remiss not to mention the dedication and commitment of all our health and other essential workers throughout this crisis. Throughout this pandemic, WHO has been instrumental in galvanizing the actions of governments, scientists, development partners, and the public in taking actions that were needed to contain the transmission of COVID-19. Here again, I commend the Director General, Dr. Tedros, for his exemplary leadership and commitment during one of the most challenging periods ever experienced by WHO. This would not have been possible without the consistent commitment and exceptional expertise, and indeed the sacrifice demonstrated by the entire Secretariat. Throughout the crisis, Dr. Tedros provided strong, clear, and collaborative leadership, and these qualities persuaded the World Health Organization membership to make Dr. Tedros the sole candidate for re-election, a stand which our country, Kenya, strongly supports. As we seek to recover lost time before the 2030 deadline for the Agenda for Sustainable Development, it is our desire that the Secretariat will continue to experience the same level of unity and success. And for this, you can count on Kenya's support. Madam President, as member states, we relied on WHO to provide the most up-to-date information and technical guidance on this novel virus and to guide us as we implemented national mitigation strategies. Just as we depended on WHO during the early days and months of this pandemic, WHO is now counting on us member states to provide the same lifeline through the provision of sustainable, predictable, and flexible financing. During our tenure as chair of the WHO Executive Board, Kenya has been inspired by the determination of member states to address the long-standing issue which has been highlighted by multiple review panels. I therefore urge this Assembly to take the first bold step towards a better resourced and authoritative WHO. I'm also pleased to note that the G20, which is meeting soon, is prioritizing the financing gap for pandemic preparedness and response through the establishment of a financial intermediary fund. To ensure its success, I would recommend that the equal participation by developing countries should be considered within the governance and decision-making framework for greater legitimacy and buy-in. Madam President, the theme for this year's Assembly is appropriate and also timely. Health for peace and peace for health. Indeed, this phenomenon is not a new one, as is evidenced by one of the principles of the WHO Constitution, recognizing, and I quote, "The health of all people is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals as well as states," end quote. The challenge, therefore, is for us as leaders to determine to what extent health is being used as a tool or a bridge for peace, and conversely, how we can recalibrate our policies to recognize the centrality of peace as a key prerequisite for health. I wish to commend the work of WHO in this area under the Global Health for Peace initiative as part of its contribution to the maintenance or restoration of international peace and security. The unfinished work of the SDGs, compounded by the multiple crises such as conflicts, food insecurity, escalating energy prices, and the consequence of climate change, demand a WHO that is fit for purpose. Enhanced technical and financial capacity of the WHO, particularly at country level, is key if the WHO is to successfully leapfrog member states closer to their national health-related goals aimed at a highly dynamic and challenging environment. We especially welcome the launch of key initiatives such as the WHO Academy, the WHO CTAP, and the related mRNA manufacturing hub and spokes, which will contribute to strengthening or establishing biomanufacturing capacity within developing countries for greater resilience. The COVID-19 pandemic necessitated the rapid development of diagnostics, therapeutics, vaccines, and other global public health goods. The pandemic, however, also exposed the over-dependence of developing countries to external markets, thereby hampering efforts to ramp up production of the necessary health products as well as technologies. To support the sustainability of new manufacturing initiatives, all stakeholders must come together to address the financing, coordinated technology transfer, including affirmative action, as well as market access for locally manufactured products. Going forward, we would urge Gavi, the Global Fund, PEPFAR, and other major vaccine and essential medicines purchasing organizations to lead the way in prioritizing procurement of these locally manufactured health products from the countries they serve most. We call on WHO to promote the success of these manufacturing plants through supporting regulatory systems, strengthening the expeditious pre-qualification of these locally produced products, ensuring market access and procurement for the finished products from these spokes. Madam President, Kenya is pleased to have been selected as one of the MRA spokes, which will complement the WHO Emergency and Logistics Hub in Nairobi. Through the Africa CDC, Eastern Collaborating Center in Nairobi, we are committed to building the necessary capacity in Africa for health emergency prevention, preparedness, and response. And we stand ready also to provide and surge capacity in other countries when called upon to do so. Madam President, the current pandemic has revealed the level of inequality across the world. From the global level, the national level, as well as the subnational level. No country or sector has been spared from the devastating impact of COVID-19. And this is especially true for developing and least developed countries, which are more vulnerable to economic shocks and disruptions to global supply systems. As each country plans its social and economic recovery strategy, it is important to focus our collective attention on the very real risk and impact of an uneven economic recovery and what this portends for our long-term pursuit of ending inequality amongst countries and peoples. Indeed, in the words of the UN Secretary General Antonio Guterres, COVID-19 is the biggest moral failure of our lifetime. As we speak, 1.8 billion people in low and middle-income countries have yet to receive their first dose of COVID-19 vaccine. While the availability of vaccines has improved significantly, lack of political commitment early on in the response has left many countries confronting vaccine demand challenges which are sometimes compounded by operational and financial constraints in the rollout of vaccines. The various review processes at global, regional, and national levels have pointed clearly to the shortcomings of the prevailing health architecture and its inability to adequately protect those who are weak and most vulnerable from catastrophe and devastation arising from pandemics. This is part of the reason why in March of 2021, I joined other global leaders to call for the development of a new international treaty for pandemic preparedness and response to increase global solidarity and to promote equity. As a trusted partner to many countries, WHO must remain central to the global healthcare architecture as we move forward. Madam President, it is undisputed that COVID-19 pandemic has presented challenges that have eroded significant gains towards the realization of the Sustainable Development Goals. Disruption of health service delivery have negatively impacted programs dedicated to maternal and child health, immunization, HIV, TB and malaria, non-communicable diseases, amongst others. As the chairperson of the African Leaders Malaria Alliance, I would like to highlight that in 2020, there was a rise in the global burden of malaria with an estimated 627,000 deaths and 241 million new cases of the disease. No single tool that is available today will resolve the problem of malaria. I therefore call for greater investments in innovations for malaria, TB, HIV, and other neglected tropical diseases, innovations that will bring about new disease control approaches, diagnostics, medicines, and other tools to speed the pace of progress against these priority diseases. As one of the malaria endemic countries, Kenya, together with Mali and Zambia, are currently piloting targeted sugar-based products intended to prevent outdoor malaria transmission. Kenya was also instrumental in the development of the malaria vaccine and is one of the 3 countries to pilot its use alongside Ghana and Zambia. Indeed, in my inaugural speech of 2017, we did announce my administration's Big 4 agenda for economic development. And among these was the promise to attain universal health coverage by the year 2022. In addition to food security, affordable housing and manufacturing, but to attain UHC, my administration, with the invaluable support of the WHO, has undertaken major policy and legal as well as administrative reforms within our health sector. To ensure successful implementation of UHC, and in partnership also with the private sector, my administration has also invested in health infrastructure and development of a digital health platform to support the effective monitoring of our health sector. With regard to maternal and child health, Kenya's Linda Mama program has improved the provision of high-quality maternity delivery services in public health facilities, and this for free. Other subsidy programs have also been implemented for older persons and persons living with severe disabilities in our country. While much progress, therefore, has been made, we continue to work with our development partners as well as our private sector partners to address challenges related to shortages of skilled healthcare workers, low insurance coverage for the population, inadequate financing for health, inadequate infrastructure and equipment, disparities also in access to services by geography and populations, as well as emerging external threats such as climate change, occasioned by global warming, and other geopolitical threats. These challenges are not unique to Kenya, and we continue to observe the same trends across the world. Additionally, we have witnessed a sparked rise in the prices of food and fuel, affecting developing and least developed countries the hardest, and yet we have no role in this particular crisis. The World Bank projects that global growth will slow down from an estimated 6.1 percentage points in 2021 to 3.6 percentage points in 2022 and 2023. In the Horn of Africa and Sahel, 20 million people are also at risk of starvation due to 4 years of prolonged drought and failed rains. To be able to effectively mitigate against the negative impacts of these pandemics, we require the concerted efforts of all players within the multilateral setting. Madam President, I say all this to emphasize that we are one people, interconnected, and with a shared future. No country is immune, and no country, however well-resourced, can do this alone. We must therefore foster greater cooperation and collaboration to find lasting solutions to the challenges facing our generation. This will set us on the right path towards sustainable development and attainment of the highest standards of healthcare to our people. Nationalism, fragmentation, discrimination, exploitation are not the ingredients for the world we want for tomorrow. More than ever before, we must all recommit to the principles of the UN Charter and empower our multilateral institutions to assist countries to respond to present crises, rebuild our economies and societies, and address climate change and its impacts. In conclusion, I wish to once again underscore that the foundations for building a better tomorrow must be laid by all of us today. Every one of us here has the power to shape the next chapter in our common history and our common destiny. Let us without hesitation take bold decisions and actions to ensure that we realize our common aspiration to promote health, keep the world safe, and serve the vulnerable. Together, let us ensure that we have a legacy of cooperation, solidarity, equity, and inclusiveness, and I am more convinced that this can happen, and my friends, it is within our reach if we do work together. I thank you all for your attention. Thank you.
Thank you, Excellency. I have now the honor to invite the President of Croatia, His Excellency, President Zoran Milanovic.
Madam President, Mr. Secretary General, Excellencies, ladies and gentlemen, it is my particular pleasure to address the 75th World Health Assembly gathering today in Geneva, at the very day when Croatia marks the anniversary of its membership to the UN. Exactly 3 years ago, Croatian flag was for the first time risen in front of the UN headquarters on East River and in other United Nations hubs. The adherence to the World Health Organization in this context for the young independent state where the war was raging was of special importance to us. This was our debut on the global scene where we looked for assistance, but also offered the lessons learned and the goodwill to work together for common global good. The theme of this year's assembly, Health for Peace, Peace for Health, resonates with us loud and clear. It brings back the deep memories of shelling of hospitals, health facilities, and ambulances transporting victims during the war in Croatia in the 90s, as well as health emergencies stemming from large number of civilian casualties. Even children's hospitals were not safe havens at a time. Furthermore, the situation indirectly worsened chronic disease in the population. Several limited epidemics of infectious diseases were also reported. However, the system responded with resilience. National emergency was declared, mobilization of healthcare workers was ordered, and special war hospitals with civilian health staff were created. The country maintained a universal healthcare system that managed as well to assist the large number of refugees that in 1992 amounted to 15% of the Croatian population, while around 1/3 of the country was occupied. End of the war was just the beginning of assessing the consequences and long recovery. We feel, therefore, deeply for the hardship and suffering of all people facing the war and the war's consequences. I watch with immense sadness and disbelief that attacks on hospitals and healthcare facilities remain the terrifying contemporary feature in Ukraine these days. Tragically, as we know, Ukraine is not the only emergency the world is currently facing. It might be in the spotlight right now, but there are many conflicts occurring globally that deserve equal support and attention from us. I believe it is clear that peace is precondition for inclusive, equitable access to health as part of other inclusive and equitable access to other social services. I fully agree with the Director General that health can be a driving force for peace, and that, I quote, cannot be health without peace, and there cannot be peace without health, unquote. I'm therefore looking forward to the result of this high-level debate aimed at building a healthy and peaceful planet. Mr. President, Excellencies, when this Assembly met in previous 2 years, there was a single subject dominating the agenda, the COVID-19 pandemic. The pandemic has damaged the health worldwide in direct and in many indirect ways. Over 6 million deaths were attributed to coronavirus in the last 2 years. The pandemic has been a severe disruption to health systems, economies, and for society worldwide. Its consequences affected the progress in health-related targets in SDGs and undermined the overall health of world population. Mental health remains a particular concern, and new generations have been seriously impacted. The resilience and preparedness of the national health systems have been seriously challenged. In Croatia, during the first COVID-19 pandemic wave, the devastating earthquakes further stretched the health system. The COVID-19 pandemic has also highlighted profound weakness in the global governance of health. Inadequate preparation, coordination, and accountability hampered the collective response of nations at each stage. It highlighted the need for a stronger and more inclusive health emergency preparedness, response and resilience architecture, and has revealed deep inequalities in the global ecosystem. We should build a stronger and more inclusive global health architecture to mitigate the health and socioeconomic damage of the ongoing challenges and to prepare for the next major global threat to health. Allow me at this point to thank the Director General, Dr. Tedros Ghebreyesus, for tremendous efforts of the WHO and his personal efforts in handling the pandemic. In this context, Croatia fully supports the WHO leading and central role in this process and its role at the heart of the new global health architecture. Predictable and sustainable financing is fundamental for fulfilling WHO core mandate with its independence, technical expertise, and ability to do a long-term planning. Croatia considered the establishing legal standards for assuring compliance is a fundamental part of an effective multilateral cooperative response. This is why Croatia is actively advocating for the Pandemic Preparedness and Response Agreement. I would like to add my voice in calling for continuous focus on better preparedness. This week, a report by the WHO panel came out with serious conclusion that the governments around the world are no better prepared today to address a new global disease threat than they were prepared just before the coronavirus outbreak began in late 2019. Excellencies, if there is one positive outcome of the pandemics, that would be the success we witness in fast and successful development of COVID-19 vaccines. The access to vaccines, on the other hand, drew the attention to the issue of equality and equitable opportunities. In light of this, the importance of the global ACT Acceleration Initiative and its vaccine platform, COVAX, becomes clear. In addition to these efforts, where the European Union played the decisive role, the solidarity in the context of vaccine sharing is important. Croatia has so far donated over 1,500,000 vaccine doses, most throughout COVAX mechanism and bilateral cooperation to several of our neighbors and in Africa and Asia. In conclusion, I would like to remind on the heritage of the first president of the first World Health Assembly back in 40s, a Croat doctor, Andrija Štampar, who showed his broad understanding of public health. He argued that diseases are caused not only by physical and biological factors, but also by economic and social conditions. His principles encompass the vision of health as a state of overall well-being and society as the key responsible healthcare provider. Dr. Štampar called for action to enable all people to enjoy good health in the widest sense of that word. These days, this way, he said, WHO would, I quote, become a powerful pioneer of world peace and understanding among nations, unquote. Likewise, as foreseen in the WHO Constitution, quote, the health of all peoples is fundamental to the attainment of peace and security and is dependent upon the fullest cooperation of individuals and states, unquote. This 75th World Health Assembly is a historic opportunity that we have to make a difference by taking right, responsible, and determined decisions. Thank you all. Good health to all.
Thank you, Excellency. I understand His Excellency, the President of Croatia, will have to attend to an urgent matter and will therefore seek leave of us. We thank him for his participation. Thank you. I have the honor to now invite the President of Dominican Republic, His Excellency President Luis Abinader Corona, to give his remarks.
Honorable
Distinguished Dr. Tedros Ghebreyesus, Director General of the World Health Organization. Distinguished Mr. Wegman, the President of the 74th World Health Assembly. Your Excellencies, Heads of State and Government and Vice Presidents, here present, and who are also joining us virtually. Distinguished Heads of Delegation of the Member States of this organization. Ladies and gentlemen, for me, it's a true honor to address this distinguished assembly on behalf of the Dominican people, both to congratulate your efforts in this so difficult time, as to encourage the continuation of your work in favor of universal solutions. I would like to thank the World Health Organization, and particularly its Director, Dr. Ghebreyesus, for your invitation to share with you our experience of facing the pandemic and to express the recognition of leadership of our country in the fight against COVID-19. At a time in which the pandemic caused by COVID-19 is still ongoing, and at the time of a terrible action of war affecting global peace, we welcome that this assembly is taking place under the initiative that the Director General has designated Peace for Health and Health for Peace. Following 2 years of a pandemic which has tested humanity and all of its institutions, this meeting is an historic opportunity to strengthen universal architecture for security and health. The toll of victims of this disease is counted in millions. They no longer have an identity, they have become a statistic. However, the legacy of those lost can never be forgotten. Now, Even with almost all restrictions lifted, as this organization states well, we must stay alert, take care, and keep our guard high in this changing and constantly adapting world. In the Dominican Republic, we have learned that flexibility in decision-making has been decisive to win some of the battles in this health war. We have therefore taken a decided step to ensure interventions in vaccination, the administration of innovative medicines, and the swift confinement based on local knowledge of our doctors and on our prior research. We are moving forward, extending our vaccination program, issuing a third dose. A cross-cutting decision, which without any doubt has been fundamental for ensuring that we have not exceeded an overall fatality rate of 0.75, one of the lowest in the world. The lessons learned from the pandemic open up the way for a new international pact in favor of global governance in health. Governance which must be built upon solidarity, both in the dissemination of knowledge, in technologies, in more adequate public policies for risk management and the management of health threats, as well as equitable access to therapeutics and vaccines that are currently available. We understand that as part of the tragedy which has shaken our nations, governments have had to prioritize their populations and guarantee immediate access to the most effective solution available, vaccines. But here, at this assembly, we must review our criteria of solidarity, committing going forward to the right to health of all citizens of the world, regardless of where they live. It is necessary that we reassess the criteria and mechanisms on the basis of which we provide access to developing countries to the essential inputs to allow them to continue to progress in eradicating the pandemic and to attenuate its impact domestically. The Dominican Republic, in view of this reality and despite its limited resources, has decided to make donations of vaccines to other countries of the region, always motivated by the solidarity which defines all Dominicans. Here we would like to highlight that the socialization of knowledge, of research, and of efforts to innovate with new strategies, technologies, and new therapeutic molecules to fight against COVID-19 will contribute to the exponential development of our fight against this pathogen, as well as against future threats and pandemics. And looking forward to the future, we have entered into dialogue with other countries of the region to pool our most distinguished researchers in a cutting-edge laboratory which will allow us to investigate, research, and develop our own vaccines. Allow me to share with great pride our national experience, how we have faced the challenges raised by the pandemic, its impact, good practices, and the important results achieved. We have managed to be a country open to the world, with one of the lowest fatality rates on the planet. This is born not out of chance or a turn of fate, but rather rigorous, well-planned, responsive policy, and thanks to our healthcare professionals, to whom we are eternally grateful for their work. During this pandemic, to date, we have recorded 581,044 cases, with 576,006 recoveries, and 4,377 deaths. To date, we have administered more than 15 million vaccines nationally, guaranteeing a 2-dose vaccination program to almost 6 million people out of a target initial population of 7.8 million. We also have, furthermore, 4 doses of vaccines guaranteed per person of the population for free. All of this has been possible because of the responsible behavior of our citizens, helping civically with the receipt of their doses according to an established vaccination plan, a house-by-house rollout strategy with vaccination points equivalent to 1 per every 5,000 people. The good management of the health emergency has allowed us to recover in our economy at a very high rate, and the World Tourism Organization recently recognized the Dominican Republic as the first country in the world to achieve the full recovery of its tourism following the pandemic. We were also recently declared as a Category 1 country in terms of COVID-19 risk by the Center for Disease Control of the United States, the US CDC. The rollout of the third dose, in which we were pioneers, has allowed us to increase 40-fold the levels of antibodies among the population receiving it, contributing to mitigating the impact of the Delta variant, reducing the number of cases, hospitalizations, and deaths when compared to previous outbreaks from the ancestral Beta and Gamma variants. This process went together with a rigorous clinical study published in an article in the prestigious Nature journal last January, which was lauded by the International Society for Vaccines because of the number of times it served as a reference for studies in other countries. We have strengthened our national laboratory, guaranteeing to everyone that needs it in our country PCR tests with results returned in less than 48 hours, and we rank highly in Latin America in implementing vaccination in children. The Dominican Republic has undertaken the commitment before this organization to decidedly support proposals made to guarantee its sustainable financing. Nationally, our government is proposing to guarantee sustainability of our healthcare system with the efficient and honest management of public resources. For 2022, we have increased our health budget by an amount similar to 0.4% of our GDP. However, we still recognize that this amount is not enough to meet our needs, and we reiterate that any fiscal reform in the Dominican Republic will have, as one of its key objectives, increasing public expenditure in health. I would like to recall the words of the Director General in his inaugural speech in 2017, when he stated that all roads lead to universal health coverage, and only half of the world's inhabitants have access to it. It is therefore necessary to indicate that since we took up office in the government of the Dominican Republic in August 2020, we have included 2.3 million more citizens in basic health insurance through the National Health Service, SENASA. Thanks to this mass inclusion, approximately 98% of the population of the Dominican Republic today have at least basic health insurance coverage. In order to ensure sustainable and lasting peace, it is necessary that we guarantee universal health coverage, and this includes ensuring equitable access, particularly for those countries most in need, to vaccines and health technologies, creating a fund to address future crises. For its part, the Dominican Republic takes up its commitment as a member state of this organization to work together with it for a healthier world, a fairer world, and a world with equal hopes for all. Thank you very much, and I wish you a highly beneficial assembly.
Thank you, Excellency. I have the honor to now invite the President of Botswana, His Excellency President Eric Masaise.
Madam President, Excellencies, Director General, distinguished delegates, allow me at the outset to thank you, Director General, for this opportunity to address the World Health Assembly. I am indeed humbled to be able to share Botswana's health trajectory, particularly in the midst of our efforts to recover from the COVID-19 pandemic. The COVID-19 pandemic has had a severe health and socio-economic impact, disproportionately affecting countries with the least capacity to respond and protect lives and livelihoods. This in addition to being faced with several issues, including worsening poverty, humanitarian crisis, increasing geopolitical instability, and climate issues, among others, which require our collective action and global solidarity. First and foremost, our collective experience from the COVID-19 pandemic has exposed glaring inequities and inequality, both within communities and between nation states, with low and middle income countries experiencing a disproportionate impact of the pandemic. Regrettably, there was lack of global solidarity, particularly during early period of the pandemic. This was evident both at the decision-making on medical products, such as vaccines and personal protective wear, as well as resource allocation to combat the pandemic. This resulted in preventable loss of lives and disruption of quality essential health services. This will undoubtedly affect the recovery process, stall and in some cases regress achievements towards attaining the Sustainable Development Goals. Madam President, Excellencies, it should be recognized that universal health coverage implies that all people have access without discrimination to affordable quality health services, without exposure to financial hardship, and with special emphasis on the poor, the vulnerable, and marginalized segments of the population. This holistic framing of responses to health issues in public policy underscores the determination and willingness to safeguard the national economies while striving to protect the lives and livelihoods of their constituents. To this end, post the peak of the COVID-19 pandemic, Botswana acknowledges the changing global trends that require strengthening our health systems to achieve universal health coverage as a means of attaining the Sustainable Development Goals. It will be recalled that at the 2019 Political Declaration of High-Level Meeting on Universal Health Coverage, member states pledged to, and I quote, enhance emergency health preparedness and response systems, as well as strengthen capacities at national, regional, and international levels, including to mitigate the impact of climate change and natural disasters on health, end quote. I further recall our commitment in the Africa region through the Abuja Declaration for the governments to ensure that at least 15% of national budgets is allocated to health. Having recognized the interplay between health and development, Botswana affirmed its commitment and accordingly aligned its strategies to the health in the 2030 Agenda for Sustainable Development. These include our 11th National Development Plan, which runs from April 2017 to March 2023, and the draft 12th National Development Plan, and our National Long-Term Vision 2036. Madam President, Excellencies, in my National Reset Agenda, I have committed as a first priority to save Botswana's population from COVID-19 through the implementation of life-saving programs that include a successful and timely vaccination program. To date, 69% of the total population of Botswana has received at least one dose of the COVID-19 vaccine offered in the country. The proportion of the fully vaccinated is at 61%, out of whom 37% have received their booster dose. We believe that we are on track to attaining the 70% coverage fully vaccinated of the entire population by July of 2022 to achieve the World Health Organization target. Furthermore, as a developing nation with a high HIV/AIDS burden, in December 2021, Botswana received a Silver Tier Award for the from the World Health Organization for path to elimination to mother-to-child transmission of HIV. This makes us the first high-burden country in the world to attain this certification. This achievement came from recommendations from the Global Vaccination Committee, setting us on course towards a gold tier of both HIV and syphilis by 2024. It should be noted that this is against the backdrop of the country having surpassed the set global UNAIDS targets from 1990 with a resounding achievement of 93, 97, and 98, as per our National Behavioral AIDS Impact Survey, BIAS-5, of 2021. We continue to be on the path to eliminate malaria, having sustained a low incidence rate of below 1 per 1,000 population in the last 5 years. Through the WHO Global Malaria Program of E2025 initiative, Botswana is one of the countries that are fully committed to malaria elimination by 2025. I am proud to share with this assembly today that we are aligned to the WHO Global Non-Communicable Diseases Action Plan of 2013-2020. Our parliament passed the Tobacco Control Bill, which I assented to in October 2021. The Tobacco Control Act of 2021 is part of our commitment to strengthening the WHO Framework Convention on Tobacco Control while protecting the nation against harmful effects of tobacco use and smoke. Madam President and Your Excellencies, despite the successes as an upper middle income country, we continue to experience challenges that negatively impact on our progress. These include limited access to safe medicinal products, research and development, challenges of availability of essential list drugs, inability to attract and retain quality and skilled health personnel, among others. Against this backdrop, I am therefore pleased to report to this assembly that my government has partnered with Nant Works, Nant, Botswana, to establish a vaccine manufacturing facility in the country. And through our local health regulatory authority, has approved the manufacturing of Botswana's first COVID-19 vaccine, Ulavax, it's called. The facility was launched on the 28th of March, 2022, and will be housed at the Botswana Digital and Innovation Hub's Science and Technology Park. Nant Botswana will manufacture and produce not only vaccines for COVID-19, but also for cancer treatment and next generation cell-based immunotherapy, among others. In this regard, we are confident that the WHO and partners will continue to support local and regional efforts in vaccine manufacturing facility technology transfer. It is equally important for the WHO, Gavi, UNICEF, and other partners to commit to purchasing products developed in our region, which will ensure sustainability of the facilities. I also wish to implore the Assembly that we strengthen collaboration with CEPI and UNITED to support local and regional manufacturing initiatives. Consistent with the National Smart Bot Strategy that aims to drive national digitalization agenda, we have also established innovative digital platforms that can actively participate in the global platforms with timely quality data to support health surveillance, research, and security together with our academic institutions. Madam President, Excellencies, given our collective goal to recover equitably from this pandemic, and in recognition of the constraints of preparedness and response to a global pandemic, Botswana fully supports the elaboration of an international legal instrument under the auspices of WHO. This new instrument should seek to build on the experiences and lessons learned from the COVID-19 pandemic, with special attention to addressing the needs and priorities of developing, least developed countries and countries facing humanitarian crises. The legal instrument, the international legal instrument, should therefore address the need to access vaccines and therapeutics in a timely and equitable manner, including scaling up of national and regional manufacturing capacity through advancing and acceleration of research and development, as well as mechanisms for facilitating technology transfer and removal of intellectual property barriers. There is also a need for this instrument to have accountability mechanisms, including having regard to the WHO guidance in terms of travel and trade. You will recall that in November 2021, when Botswana and South Africa first identified and reported a new variant of the SARS-CoV-2, otherwise known as Omicron, some member states immediately imposed travel and flight restrictions on several Southern African countries. This was a very unfortunate knee-jerk reaction against us and against good quality ethical science. The treaty should therefore seek to give incentive for timely and transparent reporting by reinforcing the obligations of member states. It should also emphasize agreement on unbiased and evidence-based travel regulation that is anchored on the principles of solidarity, transparency, cooperation, inclusiveness, and equity. An effective response to the global pandemic also requires adequate, predictable, and sustainable financing. As such, there is need to capacitate and strengthen the WHO to enable it to fulfill its mandate. Botswana, therefore, appreciates the progress member states have made on the agreement to increase their assessed contributions to the WHO. This is an opportune time to adequately finance the WHO to enable to act as the leading authority in global health governance and demonstrate our collective action and commitment. In line with the position of the Africa region, Botswana also welcomes and supports the proposal to increase assessed contributions to 50% of the budget by 2028 to 2029 to WHO. Furthermore, I wish to appeal to developed countries and donors to reduce the earmarking on voluntary contributions, which has the advantage of enabling the organization to address its broad priorities and enable it to provide adequate leadership and technical support to countries. Madam President, Excellencies, before I conclude, I wish to note that Botswana, in her capacity as a WHO Executive Board member, participated in the nomination of Dr. Tedros at the 150th board meeting in January of this year. Dr. Tedros has shown great leadership at the helm of the organization, most importantly, when the world is facing one of the hardest and unprecedented health and socioeconomic crises in modern time. My government believes that the reappointment of Dr. Tedros will afford him the opportunity to continue to lead the organization and complete the mandate of the 13th General Program of Work, GPW 13, as extended to 2025, including its triple billion targets set for WHO to support us in realizing the SDG 3 by 2025. I warmly invite member states, therefore, to, like Botswana, support Dr. Tedros for the post of Director General of WHO. I thank you, Madam President.
Thank you, Your Excellency. I now have the honor to invite the Vice President of Ecuador, His Excellency Alfredo Enrique Borrero Vega, to make his statement.
Excelentísimo.
Your Excellency, Dr. Tedros, Director General of the WHO. Your Excellencies, representatives of brother countries, ladies and gentlemen, Ministers of Health, ladies and gentlemen, representatives of all states participating in this World Health Assembly. I'd like to extend to you a heartfelt greeting to you as a doctor and currently as the Vice President of the Republic of Ecuador. We do not worry about what we have done, but we worry about what we have stopped doing, and we focus on what we are to do. Health is not time-bound in nature. I'd like to take this opportunity to express our gratitude and recognition to the Pan American Health Organization and all those who are among its member states on the occasion of its 120th anniversary. We have many reasons to be proud. And we must and do celebrate over those many years of service, important efforts and achievements made in favor of public health. Thank you to the organization for its leadership and its commitment. The entire world is facing multi-dimensional crises and increasing conflicts. The increasingly acute cry for help on our climate, and the heavy shocks of a pandemic which is ongoing. These have posed many and new challenges. The need to strengthen dialogue and an obligation for change toward a new era for public health in our world. This era must be defined by a different international architecture, by concerted and creative action, changing the course of our history, and seeing us take up the obligation to protect future generations. This architecture is now more than ever essential. We have to reconnect. We have to stand united. And we must ensure social justice. Sustainability and solidarity will serve as a guide for all of our nations. This architecture must be built upon three fundamental pillars. First and foremost, it will be crucial that we engage in global peace-building efforts. Peace is the foundational value for balance in our society, for the mitigation of human suffering. As rightly stated by the slogan of this assembly, the first in-person meeting held since 2019, we need peace for health. And just the same, we need health for peace. This is an expression of recognition of the sensitive and interdependent nexus between peace, security, development, and health. Health and peace have many implications and reach far in impacting welfare both individually and collectively. Guaranteeing it is our task. Secondly, strengthening health systems, and with that, building capacity for preparedness and for response, cultivating resilience faced with pandemics. In order to build this resilience and to ensure greater capacity, and in order to ensure robust global governance faced with health emergencies, we must continue forward with this process under the auspices of a new general agreement which is currently under negotiation and which allows the adequate interpretation and application of and compliance with international health regulations. But this strengthening of capacity also requires significant strengthening of international cooperation. With that cooperation, we will improve our systems for alert, for surveillance, for the dissemination and exchange of information, and then we will ensure the proper research, and we will produce and distribute countermeasures, among others. This must be an architecture which brings renewed dynamism and underpins an ethical imperative, a moral and development-oriented obligation, that of universal health coverage. Access without any discrimination to comprehensive health services. Services that are adequate, timely, high quality, and needs-based. This is a task for us all, and it is a fundamental one. We will only achieve success if welfare is an unequivocal condition for all, but in particular for those most vulnerable and most marginalized. And to achieve that, we need to look and listen attentively and responsibly to what lies at the heart of the needs of families and the communities that are the most remote and most in need. Efforts will be required in many areas to achieve this, and one of those will be the promotion of equitable access to high-quality surgical interventions. These are certainly complex challenges, but there is a lot that we can do to make that difference. And we can achieve this, but only together with a spirit of solidarity and cooperation. These struggles require time, and they require staunch political, financial, and social commitments, which remain sustained over time. It is fundamental that we work together as a team to ensure the adequate identification, prioritization, and mobilization of human, technical, and financial resources. Here, it is important to mention the relevance of making progress with commitments allowing us to contribute to financial sustainability of this new World Health Architecture and the organization that unites us around it. It is impossible to not recognize the serious economic difficulties that many member states are facing. These weaknesses have been further accentuated by the COVID-19 pandemic. However, it is also impossible to overlook the urgent need for healthy investment, sustainable financing, which is flexible and predictable, together with the appropriate reforms in governance in order to achieve a true impact and the results that this context requires in favor of global health and, of course, in favor of peace. However, I am convinced that all those here present, with hope and with deep-rooted commitment, will back this transformation for prosperity. And here it could not be less important to highlight the role and the significant work that the World Health Organization has always done on the front line, making great efforts in favor of health for all. This is the motivation that drives us all together. We look with great optimism to the renewal of the leadership of the Director General. Dr. Tedros his guidance, his tireless work, and his devotion to service have been essential in order to endure the blows of recent years, and they will be all the more so facing these new challenges to come. If you would allow me, I would put out a call to all member states and to all actors in health here present to once again commit ourselves with a spirit of openness, fairness, and strength in unity. This common goal, with determined endeavour, decisiveness, and fortitude, is within reach. Thank you very much, ladies and gentlemen.
Thank you, Excellency. I now have the honor to invite the Secretary General of the United Nations, His Excellency Mr. Antonio Guterres.
Excellencies, guests, dear colleagues and friends, this year's World Health Assembly arrives at a time when global health continues to be challenged like never before. Climate change and pollution, conflicts, deepening poverty and inequality, stretched and underfunded health systems, and the third year of COVID-19. The pandemic is a stark reminder of the deep connections between human health and the health of our world, and the moral test that humanity is tragically failing because of inequitable access to vaccines and hoarding. But throughout this crisis, the World Health Organization has been a steadfast source of hope and support. The women and men of WHO are not only on the front lines of the COVID-19 response, scaling up vaccinations, testing and treatments, they are leading the battle against other preventable diseases like measles, tuberculosis, typhoid, malaria, cervical cancer, hepatitis, and HIV/AIDS. They are safeguarding access to primary health care, clean water, and basic sanitation. Community by community, they are pushing us closer to our goal of universal health coverage for all. And they are gathering the world around preparedness to address and even prevent future pandemics. But across this essential work, WHO needs global support and investment. Sustainable funding is one of the top issues being discussed at this year's Assembly. There is no greater return on investment than health, for people, for economies and jobs, for peace and security, for our planet. Health is hope. So, as you gather for this Assembly, I urge you, invest in a healthier future for all. Invest in hope.
Thank you, Mr. Secretary General. I shall now invite the President of France, His Excellency President Macron, for his remarks.
Madam President of the World Health Assembly, Secretary General of the UN, Director General of WHO, Heads of State and Government, colleagues, it is an honour for me to be able to address you once again. Together, we have lived through the greatest health challenge in 100 years, and we are not even over that when another crisis emerges, an armed conflict that jeopardizes the very foundations of multilateralism, the system to which we are so committed, and that commitment is shown by our gathering here for the World Health Assembly once again. I wish here to state that France and the EU stand in full solidarity with Ukraine. We condemn in the strongest possible terms the military aggression committed by Russia with the complicity of Belarus. The consequences of the war are devastating in health terms, in human terms, in terms of the destruction of health personnel and health establishments, which should never be targeted. I would like to thank the WHO for what it has done in seeking to preserve in the field, despite the immense difficulties, the right to health for the people of Ukraine. The WHO will discuss the issue this week, and I would call upon all member states to support the resolution put forward by Ukraine. However, this crisis, this war that we are living through today in Ukraine, must not allow us to forget that there are many other emergencies in other parts of the globe, foremost among them the pandemic. You know that France and its European partners are very committed to tackling the consequences of the pandemic. We were involved in launching the ACT Accelerator. We were the first country to give vaccines through the COVAX. And by the end of June, we will have made available 120 million doses of vaccine, as I had earlier committed to. France, thus far, is the biggest provider of vaccines throughout the world. We have exported half of our production, and to date, we have been able to deliver to all continents 365 million doses from our own stocks, 90% of that through COVAX. Team Europe has chosen to invest in the future. We have mobilised more than €1 billion to roll out production capacity for vaccines in all parts of the world, and we are working closely with WHO to create technology transfer centres in Africa and other continents. I have been to Rwanda and South Africa discussing these issues, and I've also been in touch with many of my opposite numbers in Africa, including Senegal. The EU has been very constructive also in the stance it has taken within WTO in seeking to facilitate the transfer of licenses during the pandemic in order to ensure that patents can no longer be an obstacle to fair access to pandemic response products. We must ensure that this model is embedded for the long term, and that means changing the way that the big purchasers of health products get their supplies, whether we're talking about Gavi or the Global Fund, because buying local, maintaining production capacity at local level in all continents is in our common interest. And I certainly know that the South African president is very committed to that. Since we're talking about this, just allow me one aside about Unitaid. Unitaid is very much in the forefront of fighting for local level production. Unitaid made it possible for licensing agreements to be reached with Pfizer and Merck in terms of COVID therapeutics through the medicines patent pool. Unitaid has been with us for 15 years now, and I thank you for your support in continuing to allow it to play the unique role that it does. Our collective mobilisation has indeed pushed the pandemic back, but the fight's not over. There still may be a resurgence. There may be new variants. The vaccination rate in a number of countries remains worrisome and cannot provide collective protection if a new wave emerges. We must therefore maintain our efforts, especially by providing support for vaccination campaigns in the field all over the world. I would call upon all governments to bear that in mind. And last week, France announced that it's mobilising additional resources for the ACT Accelerator, around €100 million that can be used this year for COVID vaccination. Generally speaking, the difficulty in rolling out vaccination campaigns reveals the fragility of our health systems. It's time for us to commit further and to invest more in healthcare systems, primary healthcare systems, because that's the best possible way of preparing ourselves for future pandemics. I'm not convinced that this commitment requires a specific instrument. Rather, we need to rethink the way that we work on global health issues and the resources that we provide to governments to deal with these problems through multilateral programs and bilateral assistance. We need to build systems that are much stronger in terms of prevention and healthcare, and that are much more resilient to crisis. We've already seen that many organisations and major financial institutions on the global scene, some of which, like the Global Fund for AIDS, Tuberculosis and Malaria, have recognised this and are indeed resetting the way that they approach these issues. The priority for me is strong support for those organisations, ensuring that their mandates include as a key issue the strengthening of locally based healthcare. But if there's one thing that we also consider to be especially important, it is strengthening the skills of health personnel. There's no point in having infrastructure or vaccines if you don't have people to receive patients and to treat patients. You know that I, alongside the WHO Director General, am very much committed to this, and we're committed to establishing an academy. And that academy will open in Lyon in 2024. The academy will be a global benchmark for training of health personnel. It will provide training through innovative digital technology for learners from all over the world, especially those from the most fragile countries. With this major project, WHO will be providing a very specific and tangible reply to questions asked about training for pandemic preparedness and response, and therefore I call upon everyone to support that initiative. Now, whether we're talking about management of health crisis or ongoing strengthening of health systems, I call you, colleagues, to support WHO to continue to provide the kind of steadfast support that it needs. WHO is the only legitimate institution we have that can guarantee universal health and allow us collectively to find a coordinated, united response to the challenges we face based on solidarity. That's why France has doubled its contributions during this crisis period. I would like to commend the role played by Dr. Tedros in particular. France has put forward his candidacy for a second mandate. We have every confidence in him to continue to transform WHO in the years ahead. Recent months and years have allowed us to get involved in a fascinating conversation about what WHO is and to ensure that global decision makers are really thinking about global public health and pandemic preparedness. Many proposals are on the table, all seeking to strengthen WHO in its role in terms of scientific coordination and standard setting within a One Health approach. We also recognise that it needs more resources, financial resources, greater contributions, resources in terms of access to data, because member states of WHO are responsible for implementing WHO guidance, but also for giving WHO the information it needs to take the right decisions. As well as that, we need the kind of resources that can ensure that we have good global health preparation for emergencies. And this would involve a peer review mechanism. Like any international organization, WHO must guarantee the active involvement of its member states, especially in times of crisis. Therefore, France supports the establishment of a standing committee within the EB to deal with health emergencies. We call for that body to be ambitious so that we can collectively be ready for any emergency that may arise. In order to allow all of these reforms to be embedded in law in future, I favour the adoption under the aegis of WHO of an international legally binding agreement. This would be alongside revision of the IHR so that they can be better adapted to meet the evolving health risks that we face today and can be properly implemented. I count on all members of WHO and on the Director General's ability to get everyone on board in order to ensure that we can conclude all of this work. We need that if we are to have free and open science that is free from any political pressure. We also need effective measures and mechanisms to prevent crisis and respond rapidly to them. We need mechanisms that can allow us to organise ourselves together so that we can deal with crises when they do arise. That's true for this pandemic, but it's also going to be true for anything we may face in the future. New pandemics, interactions where we see problems with biodiversity and human health. All of these things are our responsibility. It's not our responsibility to attack WHO. We need to complete it, to strengthen it, to make it more independent, to make it stronger, so that we can build a safer world for our children and our children's children. Thank you.
Thank you, Your Excellency. With immense pleasure, I shall now invite the Prime Minister of Bangladesh, Her Excellency Sheikh Hasina Wazir.
Bismillahirrahmanirrahim. Madam President, Excellencies, Mr. Director General, distinguished delegates. I am happy to join you virtually at the 75th World Health Assembly. I thank Mr. Tedros for inviting me. COVID-19 pandemic is still having huge impacts on lives and livelihoods around the world. In Bangladesh, we managed to tackle its threats through a combination of healthcare, fiscal and social safety measures. We announced 20 stimulus packages worth $23 billion, which is about 6.3% of our GDP. We provided cash and other assistance to nearly 40 million vulnerable people. We provided vaccines to our people at free of cost. We managed to contain the pandemic in the most densely populated camps for Myanmar's forcibly displaced Rohingya. My government allocated $1.61 billion for procuring vaccines from our national budget. We also thank our development partners for their donation of COVID-19 vaccines, including through COVAX. Over 100% of our target population has already been vaccinated. We are grateful for the dedicated work of our frontline service providers. We try to stand by our neighboring countries with medicines, PPE, and healthcare workers. We believe that vaccines should be treated as a global public goods. We cannot ensure a sustainable recovery by leaving millions behind in our vaccination efforts. Technology and technical know-how need to be shared to scale up vaccine production in developing countries like Bangladesh. We must work towards including the pandemic treaty for an inclusive and equitable response to future pandemics. Ladies and gentlemen, we must give added attention to climate change impact on disease burden. Bangladesh stands ready to collaborate on medical research, including for neglected tropical diseases. Antimicrobial assistance needs to be addressed in a concerted manner. We must remain focused on non-communicable diseases expanding in developing countries. We need to invest further in research and access for cancer and diabetes treatments. Mental health issues deserve to be addressed as part of our health emergency response. We seek international support in preventing road accidents, drowning, and other public health hazards. I again thank the Government of India and WHO for taking leads on traditional medicine research and standards. Bangladesh remains committed to achieving SDG 3 to promote healthy living for people of all ages. We have been able to take healthcare services to the doorstep of our people through more than 18,000 community clinics and health centers. We are actively working on child nutrition, with marked decline in stunting and wasting between 2007 and 2019. We aim to have 65% birth deliveries by skilled attendants and 50% coverage of 4 antenatal care visits by the end of 2022. Distinguished delegates, WHO remains the most important actor in global health governance. We must provide sustainable financing and allow necessary reforms to enable WHO to support health systems around the world. Bangladesh commits to do its part in line with our priorities for public health and diplomacy. I thank you all.
Thank you, Madam Prime Minister. We would like to sincerely thank all our distinguished guests for their words of encouragement and solidarity. It is my honor to now invite Director General of the World Health Organization, Dr. Tedros. Director General, you have the floor.
Thank you, Your Excellency Minister Dangmo, President of the 74th World Health Assembly, Excellency President Kenyatta, and Your Excellency President Masisi, Excellency President Milanovic, Excellency President Abinader, Excellency Vice President Borrero, and also Excellency Federal Councillor Berse, Excellencies, dear colleagues and friends, Before I continue, I'd like to also recognize the video message from President Macron, from Prime Minister Hasina, and from Secretary General Antonio Guterres. It's good to see you. It has been a while. For more than 2 years, technology has allowed us to continue meeting and to continue our work together. But as you also know, there is no substitute for meeting face to face. And I look forward to this week, to our conversations, and to moving ahead on the challenges that confront us all. The COVID-19 pandemic has turned our world upside down. Our world has endured great suffering and endures it still. I know how difficult the last 2 years have been for you and the people we serve together. People have lost their lives, loved ones, and livelihoods. Health systems have been strained to breaking point, and in some cases, beyond. Health workers have labored under extreme circumstances. Some have paid the ultimate price, and we have lost others to stress and depression. Communities have faced great disruptions to their lives, with schools and workplaces closed, and the burden of isolation and anxiety. And you, as governments, have been at the center of the storm, facing multiple challenges to protect both the health and rights of your populations, to give reassuring advice in the face of uncertainty, to counteract misinformation and disinformation, to access vaccines and other tools, and you confronted so much more. I thank all of you for your efforts to protect your communities and to work with the WHO Secretariat and our partners to protect others around the world. More than 2 years into the most severe health crisis in a century, where do we stand is the question. More than 6 million COVID-19 deaths have been reported to WHO. But as you know, our new estimates of excess mortality are much higher, almost 15 million deaths. Reported cases have declined significantly from the peak of the Omicron wave in January of this year. And reported deaths are at their lowest since March 2020. In many countries, all restrictions have been lifted and life looks much like it did before the pandemic. So, is it over? No, it's most certainly not over. I know that's not the message you want to hear, and it's definitely not the message I want to deliver. There is no question we have made progress. Of course, we have made progress. 60% of the world's population is vaccinated, helping to reduce hospitalizations and deaths, allowing health systems to cope and societies to reopen. But it's not over anywhere until it's over everywhere. Reported cases are increasing in almost 70 countries in all regions. And this is in a world in which testing rates have plummeted. And reported deaths are rising in my continent, the continent with the lowest vaccination coverage. This virus has surprised us at every turn, a storm that has torn through communities again and again, and we still can't predict its path or its intensity. We lower our guard at our peril. Increasing transmission means more deaths, especially among unvaccinated, and more risk of a new variant emerging. Declining testing and sequencing means we're blinding ourselves to the evolution of the virus. And almost 1 billion people in lower income countries remain unvaccinated. Only 57 countries have vaccinated 70% of their population, almost all of them high-income countries. We must continue to support all countries to reach 70% vaccination coverage as soon as possible, including 100% of those aged over 60, 100% of health workers, and 100% of those with underlying conditions. Vaccine supply has improved, but absorption has not kept pace. In some countries, we see insufficient political commitment to roll out vaccines. This was impacted by the initial lack of political commitment for equity of vaccines, as President Kenyatta said. In some, we see gaps in operational or financial capacity. And in all, we see vaccine hesitancy driven by misinformation and disinformation. WHO's primary focus now is to support countries to turn vaccines into vaccinations as fast as possible. However, we still see supply-side problems for tests and therapeutics with insufficient funds and insufficient access. The pandemic will not magically disappear, but we can end it. We have the knowledge, we have the tools, and science has given us the upper hand. We call on all countries that have not yet reached 70% vaccination coverage to commit to achieve it as soon as possible and to prioritize the vaccination of all health workers, all over 60s, and everyone at increased risk. We call on those countries that have reached 70% to support those that have not. We call on all countries to maintain surveillance and sequencing. We call on all countries to be prepared to reintroduce and adjust public health and social measures as necessary. And we call on all countries to restore essential services as rapidly as possible. And we call on all countries to work with your communities to build trust. But of course, the pandemic is not the only crisis in our world. As we speak, our colleagues around the world are responding to outbreaks of Ebola in DRC, monkeypox and hepatitis of unknown cause, and complex humanitarian crises in Afghanistan, Ethiopia, Somalia, South Sudan, the Syrian Arab Republic, Ukraine, and Yemen. We face a formidable convergence of disease, drought, famine, and war fueled by climate change, inequity, and geopolitical rivalry. As you know, this Health Assembly marks the end of my first term as Director General. I'm humbled by the Executive Board's decision to nominate me for a second term. As I have reflected on the past 5 years, I realized they have been bookended by 2 visits to war zones. I made my first trip as Director General to Yemen in July 2017, a country which was and remains mired in civil war. While I was there, I met a mother and her malnourished child who had traveled for hours to reach the health center I was visiting in Sana'a, Yemen. The woman was skin and bone, begging the medical staff for care, but not for herself, for her child. Then, 2 weeks ago, I was in Ukraine, visiting bombed hospitals and meeting health workers. I visited a reception center for refugees in Poland, where I met another mother from the Mariupol area who told me that when the shelling began, her young daughter was very scared. Don't worry, her mother told her. It's just a thunderstorm. It will pass. At our warehouse in Lviv, I held a pediatric crutch that WHO was preparing to deliver, a crutch for children, but a tool that children should only need if they're injured playing sport or climbing trees. Just children being children and hurt, but using the crutch, not if they're hurt by bombs. I met people who have lost loved ones, lost their homes, lost their sense of security, and yet somehow have not lost hope. In both Yemen and Ukraine, and in other countries I have visited in between, during my first term, I saw the profound consequences of conflict for health systems and the people they serve. More even than pandemics, war shakes and shatters the foundations on which previously stable societies stood. It deprives whole communities of essential health services, leaving children at risk of vaccine-preventable diseases. Women at increased risk of sexual violence, expectant mothers at risk of an unsafe birth, and people who live with communicable and non-communicable diseases without access to the life-saving services and treatments on which they depend. And it leaves psychological scars that can take years or decades to heal. For me, this is not hypothetical or abstract. It's real, and it's personal. I'm a child war. I'm a child of war. The sound of gunfire and shells whistling through the air, the smell of smoke after they struck, tracer bullets in the night sky, the fear, the pain, the loss. These things have stayed with me throughout my life, because I was in the middle of war when I was very young, maybe 10, maybe 11, maybe 9, during that range. Like the mothers I met in Yemen and Ukraine. My mother's concern was to keep me and my sisters and brothers safe. When my mother heard gunfire at night, she would make us sleep under the bed and lay more mattresses on top of that one bed, and all children crammed in under the bed, in the hope we might be protected if a shell fell on our house. I felt that same fear as a parent myself again in 1998, when war returned to Ethiopia and my children had to hide in a bunker to shelter from the bombardment. And that's when I returned from Nottingham, where I was doing my PhD, because I was worried about family and also the rest of the country. Maybe you remember in 1998 what happened. I feel the same pain and loss again now, with war in my homeland once again. Not only a child of war, but following me throughout. But my story is not unique. It's like so many others. The story of a family who did not start the war, who were not responsible for it, but suffered because of it. And all could be centered because of bad governance, lack of leadership. War is bad enough, but it's made worse because it creates the conditions for disease to spread. Indeed, war, hunger, and disease are old friends. In the Napoleonic Wars and the American Civil War, more soldiers died from disease than in battle. It was no coincidence that the 1918 influenza pandemic, the greatest pandemic, coincided with what was then the greatest war the world had known, the First World War. It's no coincidence that the final frontier for eradicating polio is in the most insecure regions of Afghanistan and Pakistan. It's no coincidence that in 2018, the Ebola outbreak in the relatively stable Equator province of DRC took 2 months to control, while the outbreak in the insecure regions of North Kivu and Ituri took 2 years. Where war goes, hunger and disease follow shortly behind. The COVID-19 pandemic did not cause the war in Ukraine, and the war did not cause the pandemic, but they're now intertwined. Until this year, Ukraine was among the countries that was making the most rapid progress toward this universal health coverage. We're deeply concerned about the impact of the war on these gains. Already we have seen many clinics and hospitals closed, health workers displaced, and services disrupted. I visited a hospital in the town of Makariv, west of Kyiv. Its inpatient department had been damaged by a missile strike, and its primary care department was completely destroyed. And it's not just Ukraine. So far this year, WHO has verified 373 attacks on health in 14 countries and territories, claiming the lives of 154 health workers and patients and leaving 131 injured. Even WHO is targeted. In 2019, our colleagues, Dr. Richard Muzoko from Cameroon and Belinda Kasongo from DRC were murdered in DRC while working to protect others from Ebola. Attacks on health workers and health facilities are a breach of international humanitarian law. but they're also an assault on the right to health. In Ethiopia, the Syrian Arab Republic, Ukraine, Yemen, and elsewhere, WHO is working in conflict zones to deliver medicines, equipment, training, and technical advice to support care for those who need it, to treat the wounded, to give pregnant women the conditions for a safe and supportive birth, to make sure children receive routine vaccinations, and to support health workers who continue to deliver life-saving services in the most difficult circumstances. Following the Taliban takeover of Afghanistan last year, I traveled to Afghanistan where I met a group of women nurses who told me they had not been paid in 3 months, but would continue to serve their patients. WHO paid their salaries later, so they could continue to deliver the care on which their communities depend, although lasting solutions are needed. But ultimately, the one medicine that's most needed is the one that WHO cannot deliver: peace. Peace is a prerequisite for health. During El Salvador's civil war, one-day ceasefires called days of tranquility, as you may know, that were declared 3 times a year to allow vaccinations for children against polio, measles, and more. In 1990, 159 nations signed a declaration and plan of action endorsing the need for days of tranquility, which have been used in Afghanistan, Cote d'Ivoire, Peru, Uganda, and elsewhere. There can be no health without peace. But equally, there can be no peace without health. The authors of the WHO Constitution knew this when they wrote that the health of all people is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. Health can contribute to peace by delivering services equitably to all people in a society, especially disadvantaged groups. This can help address the triggers of conflict, such as unequal access to health care, which can often lead to feelings of exclusion and resentment. Equitable health services strengthen community trust, which in turn contributes to strengthening health systems and peace building. For example, in Tunisia, in the aftermath of the Arab Spring, and with WHO support, a social dialogue for health was established as a platform for Tunisians to express their needs and ideas on health. In Sri Lanka, WHO has supported community-based psychosocial intervention called Manohari, aimed at violence reduction. In Colombia, WHO PAHO supported the reintegration of former combatants with health expertise in the health system through medical training. The resolution on health and peace that you will consider this week, if adopted, will further support the Secretariat's efforts to deliver health programs in conflict-affected areas, programs that also help to build peace. Health is one of the few areas in which nations can work together across ideological divides to find common solutions to common problems and build bridges. Excellencies, dear colleagues and friends, you have a full agenda this week, from designing the health workforce of the future to finishing the eradication of polio, to building a new architecture for global health security, and renewing the drive towards universal health coverage. But none of it can truly succeed in a divided world. It can only succeed if countries work to put aside their differences, to seek common ground where it can be found, to collaborate where possible, to compromise where needed, to seek peace. As John Lennon said, "You may say, I'm a dreamer, but I'm not the only one." Because unless we dream of a better world, we will keep waking up in this one. Unless we aim higher, we will land lower. Unless we show solidarity, we will reap division. Unless we seek peace, we will find war. Today and every day, we have a choice. We have a choice. We always make the choices. We have a choice. And today and every day, we must choose health for peace and peace for health. Peace, peace, peace. I thank you.
Thank you, Dr. Tedros, for sharing your story. We all share the pain and suffering of people living in crisis. I'm now informed that the Director General would like to recognize the contribution of some individuals and groups for their exceptional endeavor and commitment to health. Dr. Tedros, you have the floor.
Thank you, Madam President. The turmoil of this pandemic years has been profound, as you know. Unlike anything any of us have ever experienced, it has been a time of suffering and great loss. In the face of fear and hardship, our health and care workers have stood firm, often at great personal risk. Some paid the ultimate price. We are humbled. Today, I'm proud to honor some exceptional individuals who went so far beyond the call of duty to work for the greater good, to protect life and promote health. Their work and dedication should be an inspiration to health and care workers everywhere. My first award goes to honor the work of my colleague, my friend, and one of the world's foremost public health professionals, Dr. Paul Farmer. Paul passed in his sleep in Rwanda just 3 months ago. doing what he loved to do, supporting medical education at a district hospital. Paul was a true humanitarian and a tireless champion of equity and health as a human right. He was chair of the Department of Global Health and Social Medicine at Harvard Medical School and co-founder of Partners in Health. His work helped to empower health and care workers in communities around the world. He worked in places that others had given up on. He was also a prolific author, a passionate educator, and a dedicated mentor to many young health professionals. Paul once described his work as being about hope. I think Secretary General Antonio Guterres spoke about hope earlier, and about rejecting despair and cynicism. We carry that spirit with us, with the institutions he helped build and the many people that he inspired. And we continue the fight for health for all. Today, I'm honored to invite Paul's wife, Didi Bertrand, the co-founder and president of the Women and Girls Initiative, to accept the award on Paul's behalf.
Excellencies, Head of States, Mr. Director General, dignitaries, ladies and gentlemen. It is with a distinct feeling of honor that I accept this award on behalf of my beloved husband, Dr. Paul Farmer. I thank the Director General, Dr. Tedros for honoring him during the 75th World Health Assembly. There could not have been deeper meaning to this act of recognition. For 40 long years of his life, Paul has made equity and justice in healthcare his Schwalbataille, his battle horse, as he often said in Haitian Creole. In adopting this year's theme, Health for Peace, Peace in Health, WHO recognizing the need for persistent commitment addressing the root causes of inequalities and injustices in healthcare around the world. Over the past years, WHO has prioritized a number of policies that mattered a great deal to Paul. These include, number one, the recent creation of global guidelines on system support to optimize community health worker programs and the global strategy on human resources for health. Number two, WHO's support for insisting that emergency and clinical care strengthening programs, investment in emergency medical program and ICU care necessary to treat COVID be sustained to benefit the overall health system for the long term rather than the siloed short-term emergency interventions. Third, WHO's leadership in calling for essential diagnosis, treatments, and vaccines to combat global pandemics, including COVID, to be made available as global public goods through CTAP and the Medicine Patent Pool Initiative so equitable access is possible. At last but not least, WHO's recent effort in support of the AU and Africa CDC in pushing for the establishment of regional manufacturing of essential life-saving diagnostics, treatment, and vaccine on the continent of Africa. Yesterday, May 21st, marked 3 months since Paul's sudden passing. His unexpected death has equally shaken his family and the global health community. We needed him around at this critical moment in time more than ever. Now, we owe it to Paul to collectively keep his legacy alive. This is why today I am encouraging all in attendance to adopt policy decisions made on behalf of your fellow citizens, policies that will treat every person as a person and invest in the provision of high-quality, life-saving health care, as health is a fundamental health human right. This is what Paul has inspired us to do, taking always the lead through hard work and commitment to patients and their families and communities around the world. On behalf of myself and my children, Paul's mother, Jeannie, his siblings and extended family, and of course, his more than 19,000 colleagues from Partners in Health globally, I wish to express my deepest gratitude. Thank you.
My second award goes to Dr. Ahmed Hankir for his work in empowering, dignifying, and humanizing people living with mental health conditions. Dr. Ahmed is the public engagement and education lead at the WHO Collaborating Center for Mental Health, Disabilities, and Human Rights at the Institute of Mental Health in Nottingham in the United Kingdom. Dr. Ahmed pioneered the Wounded Healer, which traces his personal journey of recovery from the trauma of the 2006 Lebanon War. This innovative work blends the power of the performing arts and storytelling with psychiatry, with the aim of reducing stigma and discrimination and to break down barriers for access to care. Ahmed has delivered the Wounded Healer in person to over 100,000 people at events in 20 countries. His story is further evidence that people with mental health conditions can realize their dreams. Ahmed, it's my great honor to welcome you and invite you to come and accept this award.
Bismillahir Rahmanir Rahim. Excellencies, Director General, distinguished guests, I want to echo Dr. Tedros' salam. Peace, peace, peace. I must start by expressing my immeasurable gratitude. What an honor, what a miracle to be here with you all today. Dr. Tedros, thank you from the chambers of my heart for your graciousness, your kindness, your humanity, and your vision, and for sharing your powerful story with us, which resonated deeply with me. I'm also a child of war. Michelle Funk, thank you for seeing in me what even I didn't see in myself, and for helping to restore self-belief. People always ask me, Dr. Hankir, how do we reduce mental health-related stigma? Well, a good starting point is the human heart, and to engage in introspection and to be brutally honest with yourself, and to identify any conscious and/or unconscious biases and challenge them. But also when our leaders amplify our voices and provide experts by experience a platform to share our insights and our stories. And this is my story. I am Dr. Ahmed Zakaria Hankir, son of Zakaria Hankir, Hakim al-Sha'ab in the south of Lebanon, who provides free healthcare to the Palestine and Syrian refugees. I love you, Dad, and I love you, Mom. There's no heart like a mother's heart, and there's no mother's heart like my mother's heart. In 2006, when I was a medical student in Manchester, I woke up one morning to discover that my hometown in Lebanon was bombed and hundreds of people were killed. I saw harrowing and horrific images of dead bodies strewn on the streets of Lebanon. I saw babies being removed from the rubble, and I reacted. I developed a severe episode of psychological distress. However, debilitating though the symptoms were, the stigma was far, far worse. I was ostracized, shunned, and dehumanized, even by those who I thought were my closest companions. At the time when I needed care and compassion the most, I received ridicule and rejection instead. And in my despair, I contemplated ending that which is most precious itself: human life. However, as a practicing Muslim, I resisted the seductive impulse to end my life because suicide is forbidden in Islam, and my faith was and remains a protective factor. There are people here today suffering with their mental health in silence. Stigma and a culture of shame are formidable barriers to mental health care services. Stigma is killing people. That's why I'm outraged. That's why I'm indignant. That's why there's a fire burning in my belly and thunder in my heart to reduce stigma. Having mental health problems is nothing to be ashamed about. Seeking care is a sign of strength, not a sign of weakness. Please don't suffer in silence. Experts by experience refuse to remain silent any longer. We have voices. We can speak for ourselves, and we will be heard. Dr. Tedros spoke about the design of health services. People living with mental health conditions at all levels must be involved in the design, development, and delivery of mental health care services. We can no longer turn a deaf ear to some receiving psychiatric care, reporting that they are brutalized and that their human rights are violated. And that's why everyone must know about whose quality rights approach to mental health, which is grounded on a human rights framework, which also aims to eliminate coercion in psychiatric care once and for all. And I will close by inviting you to stand in solidarity with us and to contribute to a cultural revolution to empower, dignify, and humanize people living with mental health conditions. Please help me to disseminate our message of hope and recovery. If I can recover from mental health problems, other people living with mental health problems can recover too. And in the words of Professor Egon Dix-Falusi, on the theme of dreams, the medical and scientific problems of this world cannot be solved by skeptics whose horizons are narrowed by practical realities. We need women and men who dream of things that cannot be. And ask, why not? Thank you, Dr. Tedros, from the chambers of my heart.
Thank you, Ahmed. My third award goes to youth sports advocate Ludmila Sofia Oliveira Varela from Cape Verde for her work promoting healthy lifestyle during the COVID-19 pandemic. Ms. Varela is a member of Cabo Verde's national women's volleyball team, a youth activist on sports for health and the environment, and holds weekly training sessions for youth in Paria City. She has been involved in the national program of physical education to facilitate access to sports for all, which provides a healthy alternative to risky behaviors among young people and to tackle the growing threat of non-communicable diseases. Ms. Varela was one of the finalists for the UNESCO Global Competition on the power of sports in a time of crisis. Ms. Varela could not be with us in person, but I am pleased to invite Dr. Arlindo Nascimento do Rosario, the Minister of Health, my friend of Cabo Verde, to accept the award on her behalf. Minister.
Boa tarde, Sua Excelência, Senhor Diretor-Geral da Organização Mundial de Saúde, distintos representantes de Estados-membros e todos os participantes da Assembleia Mundial de Saúde. É com muita honra que aceito esta distinção e aproveito para agradecer profundamente à Organização Mundial de Saúde por considerar a minha contribuição relevante para uma causa maior, que é o bem-estar e a saúde da população. Enquanto desportista, tenho a honra de promover atividades saudáveis no dia a dia com a juventude cabo-verdiana. Dentre as atividades, destacam-se a minha participação no Programa Nacional de Atividade Física, que é o programa Mexe, em que estou indicada enquanto uma das embaixadoras. Também tenho a participação nas eliminatórias para os Jogos Olímpicos de Tóquio, que foi uma participação durante a pandemia. Tenho também participado numa outra competição durante a pandemia, promovida pela UNESCO, que foi intitulado o tema The Power of Sports in Time of Crisis, que é o poder do desporto em tempos de crise. Fui premiada e fui uma das finalistas e não só, tenho também recebido distinções a nível de África. Também tenho estado a participar em formações para treinadores e a treinar juntos aos mais jovens, pois estes necessitam de ter referências. E fico feliz por poder mostrar para eles boas práticas e a importância de estar sempre ativos, sobretudo física e psicologicamente. O meu papel está intimamente ligado ao espírito da Organização Mundial de Saúde e do Walk do Talk que está prestes a decorrer. Assim, encorajo a todos a estarem sempre ativos, pois o desporto não tem idade e todos devem praticar no seu próprio ritmo. E para terminar, queria dizer que é uma honra poder promover junto à juventude assuntos que envolvem o desporto e, sobretudo, a saúde, que é o bem essencial à vida.
Thank you, Ms. Varela. My fourth award goes to Mr. Sasakawa, chairman of the Nippon Foundation, for his 40 years of commitment to fighting leprosy and the stigma and social discrimination it carries. Mr. Sasakawa is the WHO Goodwill Ambassador for Leprosy Elimination and Japan's Ambassador for the Human Rights of People affected by leprosy. Leprosy is an almost forgotten disease in many countries. Mr. Sasakawa has visited many countries to advocate for leprosy control with national leaders and policymakers, but he has also made a point of meeting people affected by leprosy in some of the most disadvantaged groups. We're grateful for Mr. Sasakawa's dedication to working with WHO to reduce, in some countries, even eliminate leprosy and to stand up for human rights. Mr. Sasakawa has also cannot be with us in person, but I am pleased to invite Dr. Nanri Takahiro, Executive Director of the Sasakawa Health Foundation, to receive the award on behalf of Mr. Sasakawa.
Thank you. Director General Tedros, distinguished guests and participants, I'd like to express my heartfelt thanks for this prestigious award. I have been active all over the world on a quest to realize a world without leprosy and the stigma and discrimination it causes. I still remember the faces of patients who had been abandoned by their families and society when I visited the leprosarium for the first time. 46 years ago, they were empty of hope. That's when I began my fight against leprosy, one of humankind's oldest infectious diseases and also a human rights issue that has long tormented individuals affected by leprosy and their families. In 2001, I was appointed as WHO Goodwill Ambassador for Leprosy Elimination, based on my belief that problems and their solutions are found in the field. I have traveled to more than 100 countries, spending time in jungles, deserts, and mountains. On the medical front, the free distribution of leprosy drugs has contributed to reducing patients dramatically. On the human rights front, the UN General Assembly unanimously adopted in 2010 a resolution on elimination of discrimination against persons affected by leprosy and their family members. Efforts to address the disease and the human rights issues associated with it have come down to the last mile. However, there is a saying in Japan, on a journey of 100 miles. 99 miles is only halfway. To keep moving forward in the face of the COVID-19 pandemic, I started a worldwide campaign called Don't Forget Leprosy. This photo was taken by my friend at the highest peak of the world's Mount Everest. Please join me on the last mile to end leprosy. Thank you.
It's with great, first of all, arigato gozaimasu to Mr. Sasakawa. It's with great sadness and admiration that I present my 5th award in honor of the 8 volunteer polio workers who were killed by gunmen on the 24th of February this year in Afghanistan. These volunteer polio workers performed their life-saving work despite extraordinary challenges and risks. Together, they reached thousands of children in northeastern Afghanistan and helped to bring us all closer to our dream of a polio-free world. The workers we honor today include students, nurses, and teachers. They leave behind grieving parents, siblings, spouses, children, and communities. 4 of the polio workers we honor today were women. Polio eradication would not be possible without the courageous commitment of women who overcome extraordinary barriers to do their life-saving work. On behalf of WHO, I'm proud to present the Director General's Award to the families of Mr. Khadija Atta, Ms. Munira Hakimi, Ms. Sharfullah Hemati, Mr. Mohammed Zubair Kalzai, Mr. Najbullah Kosha, and Mrs. Hasiba Omari, Ms. Robina Yusuf, and her brother, Mr. Shadab Yusuf. I'm now pleased to invite Dr. Hamid Jafari, WHO's Director of Polio for the Eastern Mediterranean, to receive the award on behalf of the polio workers and their families. Thank you very much.
Thank you very much, Dr. Tedros. Thank you. Should I say a little word after the video? Does it have video? Yeah, I have the video. But it won't take long. Just 30 seconds.
زوی مې د اسلامي په لارې وتلی و د ملت خدمت پسې وتلی و زوی مې دغسې راته ولګېده او رایې وړ لاره راباندې ورکه شوه نه پلار و نه ورور و هېڅوک یې نه و اسمان جګ و ځمکه کلکه وه نه په اسمان ته والوتم نه په ځمکه ننوتلمه
از خانه ما 3 فرزند به جای مانده است که در راه خدمت به مردم و مه پولیو از دست دادیم. ما امیدوار هستیم که افغانستان بهترین فرصت از پولیو رهایی یابد. اکرامیه‌ای که به نظر گرفته شده است ابراز تشکر می‌کنیم.
موږ د بچیانو چې په کوم پروګرام کې و په دغه ذکرانو او موږ ته د خوشحاله شو د صحت پروګرام او بل هدف نه درلود د هلکان هلته تشویق شي چې مثلا دا کوشنده مرض د پولیو نو دی پولیو مرض د خدای پاک د ټول افغانستان ته نجات ورکړي نو دوی خپل په افتخار او خپل په رضا باندې تللي وو او دا په دې لاره کې شهیدان شو دا د صحت لاره او بیا د رضاکارانو د دې هدف لپاره دتل چې بیا د شهید لاس سره د هدف لپاره چې د مرض نه د موږ وطن د موږ خاور او د موږ ملت خلاص شي نو موږ په دې باندې خفه نه یو په دې باندې خوشاله یو هغه ډېر معصوم هلکان او ډېر ښه لاره باندې تللي په کوم لاره کې چې دوی تللي هغه د موږ د الله په نسبت انشاءالله شهیدان پاکي او د موږ په نسبت او د خپل په افتخار باندې هلته تللي دي اشتراک یې کړی ده
از خاطر اکرامی عزاداری محترم تشکری میکنیم. موقع فلج اطفال بسیار مهم است. ما امیدوار هستیم که ویروس فلج اطفال زودترین وقت از افغانستان را یابد.
افتخار میکنم که خواهرم را در راه خدمت به افغانستان و مردم از دست دادم.
رحیم مشتبه برادر نجیب الله شهید باشنده اصلی ولایت تخار از اداره محترم شما تشکر میکنم که اکرامیه که برادرم تاییدیه میکند. من افتخار میکنم که برادرم در بخش محو مرض پولیو خدمت میکرد. از بین بردن ویروس فلج اطفال وظیفه همه ما است.
Thank you, Dr. Tedros. These 8 brave health workers and their bereaved families also represent 9 frontline workers who were killed last year in the eastern region of Afghanistan, and 4 of them were also women. 36 polio workers who have been murdered in Pakistan since 2012, and 14 of their security guards who have been murdered. And around the world so far in polio eradication, we have crossed 75 frontline workers who have been killed in the line of duty. So with your call for peace, we request all present here to please do their utmost to stop all attacks on health and humanitarian workers everywhere. Thank you very much, Dr. Tedros.
Thank you, Dr. Jafari. My final award goes to India's more than 1 million accredited social health activists, or ASHAs, for their work to connect people with their health services. ASHAs are trained female volunteers who take health services to rural, marginalized, and hard-to-reach communities across India. ASHAs provide maternal care and immunization for children, community health care, treatment for hypertension, and tuberculosis, and services for nutrition, sanitation, and healthy living. They play a critical role in India's primary health care system, including during the COVID-19 pandemic, providing essential health services to millions of people. In Hindi, Asha means hope, and that's exactly what the Ashas deliver. It's now my honor to invite Ms. Seema Pujani, First Secretary from the Permanent Mission of India, to receive the award. Congratulations. Thank you.
हमारा काम एरिया में जाना है, एरिया में इम्यूनाइजेशन के लिए बच्चों को देखना और एएनसी के कार्ड बनवाना। 60 साल से ऊपर वालों को सीनियर सिटीजन कार्ड बनवाते हैं। लोग बहुत खुश होते हैं, हम उनके पास बार बार जाते हैं और उनके बच्चों के लिए उनको बताते हैं। और आशा वर्कर का कार्य अब हमें बहुत अच्छा लगता है क्योंकि लोग अब हमारी बातें मानने लगे हैं, हमें जानने लगे हैं।
কোভিডের টাইমে তো আমার কামটা ডাবল হয়েছে, কেন আমরা কোভিডের ডিউটি করছি, কাই করে বাইরের থেকে এসে ওটাও ডিউটি করছি। একটা গর্ভবতী ধরি যাই হসপিটাল, নিজে ওটা ডেলিভারি হল, ওটার বাচ্চাটার ভিজিট পিএনসি করা খায়, ওজন নেওয়া খায়।
उनका और मेरा संबंध एक कड़ी की तरह बना रहे। बच्चे का कोई एमिनेशन अगर कल होना है तो एक दिन पहले जाके उनको इनविटेशन देना कि कल तुम्हारे बच्चे का टीकाकरण है। लेकिन जब से मैंने ये आशा का वर्कर का ज्वाइन किया है तो मुझे खुद को भी अपने ऊपर इतना विश्वास और उन लोगों को भी मेरे ऊपर इतना विश्वास हो गया है। मुझे आशा वर्कर बनकर बहुत खुशी है। आशा क्या, मैं तो एक तरफ से जो नाम दिया ना आशा, मैं सभी की आशा बन चुकी हूँ।
Congratulations to all today's awardees, and of course saying namaste also to the Indian Ashas group. Although some are no longer with us, all of the awardees humble us, inspire us, and help us to keep going. So please join me once more in congratulating all our awardees. Thank you so much for sharing with us. Thank you.
Thank you, Dr. Tedros. This brings us to the end of high-level welcome. I will now request for a 5 minutes break.